Despite their influence and stature, Nevada physicians are not overtly political, but it looks like doctors are planning to make their presence known at the Nevada Legislature this year.
Monday is designated as Doctor Day at the legislature, where physicians and medical organizations hope to make an impression on lawmakers. And one issue really at the top of their list is concerns about the regulation of pain management, which doctors say has become burdensome for them and deadly for their patients. The I-Team's George Knapp has our story.
Released from a month-long hospital stay, Teresa Hatter told us about the moment she was first diagnosed with arachnoiditis.
I couldn't see. It was the worst pain I ever had. If you were saying pain at 1 to 10, I was at a 15.
For 16 years, she was a model patient in pain management. Opioid medication was her only relief. Then, out of the blue, her doctor told her goodbye and good luck.
With pain medication, you have a life.
I have a life.
Without it, you don't.
I'm in bed.
In the 90s, Tracy Davis was shot in the back. The bullet ripped through his stomach and lung and is still inside. Until recently, his insurance paid for pain medication. But then Culinary Union's plan ordered his doctor to cut the meds in half.
Somebody just decided, sorry, you don't need it.
Yes, they never ran a test on me.
Across the country, the great opioid crackdown continues. Doctors have been pressured into cutting or eliminating pain medications against their own medical judgments. Insurance companies have cut or eliminated coverage. Pharmacy chains have imposed their own severe limitations or requirements. Doctors like Maurice Gregory are squeezed by regulators, lawmakers, insurance executives, and pharmacists, none of whom have examined the actual patients.
This anti-opiate has gotten to be to the extreme of sacrificing people's lives. Now, we're already sacrificing people's quality of life.
Opioid prescriptions are now at their lowest point in 15 years, but overdose deaths are at their highest in that same time. Cutting medications for legitimate pain patients has had no effect on addicts overdosing. What it's done is create suffering for millions of people whose mistake was they got sick or injured and are now expected to live the rest of their lives in pain.
You can live 20, 30, 40, 50 years with these diseases. The only thing you can do for them is control the pain. There's no reason, why would we not want to do that?
And yet we're
taking their medication away from them and forcing them to live in torture in America in 2019. Why?
Public policy consultant Terry Murphy has had multiple surgeries and was a pain patient herself. Now she's helping Nevada doctors to mobilize. Murphy and others, including medical associations, are gearing up to make their presence known at the Nevada Legislature. Among the goals is to get a handle on changes imposed 2 years ago, which give pharmacists the ability to deny or alter prescriptions or to make excessive demands for patient information and new tests.
These decisions need to be made between a doctor and a patient, and what's happening is they're being made between a doctor, a pharmacy benefit manager, a pharmacist, an insurer, and the patient gets lost in that equation, and the doctor who really wants to help the patient is frustrated.
While doctors here feel under the gun, Murphy says Nevada is already less draconian than some states. She thinks that pending legislation could make Nevada into a model for the rest of the country, with appropriate safeguards, but also something missing from the system: compassion. George Knapp, 8 News Now.